So good afternoon, everyone. Welcome. Thank you for joining us for this important topic, understanding the impact of trauma, principles of trauma-informed care. We're very happy to be joined for this presentation by Hester Rathbone, who is the Director of Clinical Services at the Cleveland Rape Crisis Center. This is a program that she offered for us once before for the Legal Aid Society of the state of Ohio, and we're very happy that we're able to offer this very relevant education for the greater NAMI GC community. We will have time for Q&A, so please stick around through the end of the presentation. Please remember to remain muted during this program. Please utilize the chat feature if you have questions. I will be monitoring the chat while Hester is presenting, and we'll try to address as many questions as we can through the next hour, and we may go over a little bit to allow for additional Q&A if needed. This is being recorded and will be posted to the NAMI Greater Cleveland YouTube channel later this week, so you can check out that the program there, and I'll also make sure you receive the slides later today. We'll have you finish with an evaluation for today's program. Before we begin, I just want to say a few words about our organization, about NAMI Greater Cleveland. NAMI is the National Alliance on Mental Illness. We provide programming for individuals living with mental illness and their families by providing education, support, information and referral, and advocacy. You can participate in support groups for peers or families with NAMI. You can attend a peer-oriented or family-oriented educational program. You can also call our helpline if you ever have any questions about referral to treatment providers, not only mental health and substance use, but also social services like housing, legal aid, 12-step groups. Those are all inquiries that our helpline can assist with. And we also are involved in advocacy. We consider a large part of advocacy to be providing education in the community about mental health and thereby reduce the stigma around mental illness and shift perceptions, make mental health something that is okay to talk about openly in public, social, community, cultural settings. And we also want to highlight trauma literacy, not only mental health literacy, but trauma literacy. And that's why we want to offer and continue to offer programs that focus on trauma specifically. So with that being said, I will hand it off to Hester to introduce herself and carry us to the next hour with her presentation. Thank you for being here, everyone.
Thank you for the introduction, Matt. So hi, everyone. I'm really excited to join you and do this presentation. I work for the Cleveland Rape Crisis Center as the Director of Clinical Services. Just to give you a little bit of background about me, I've been at the Rape Crisis Center specifically for over 11 years now, and I've had 16 plus years working with trauma specifically. I think that this is a topic that's really near and dear to my heart because trauma is something every single one of us will likely experience at some point in life. I have a strong background working with children and families. I was an in-home therapist for a while. I've been in a couple of different agency settings where I was working with kids with developmental disabilities, family problems related to trauma or loss, and a lot of things, of course, in the background of sexual violence. So that's a little bit about me. I'd just like to talk a little bit about what we're going to be covering today. I think that one of the biggest things I like to educate people on in work, but also in my personal life, is understanding what is trauma and how does it impact our brain so that it keeps having that ongoing effect. How is it that we can be supportive for survivors of trauma, but also take care of ourselves, because that is a huge part of being able to help someone and support someone while they're going through something without burning yourself out. And then any specific questions that you have. I know a lot of times when people sign up for a topic like this, it's because there's something that maybe piques their interest, or you have a certain person or family member in mind that you want to be able to support. So I always like to leave space for people to ask about the stuff that's important to them. So you're going to see a couple of cartoons with these two guys. This is Heart and Brain. I did not draw them. They are drawn by an amazing illustrator who calls themselves the Awkward Yeti. I think that they give really great examples of what it's like to actually be thoughtful and emotional. And I always like to put this at the top of my discussions around trauma, because I think a lot of times it's really easy for us to focus on what are the negative things that trauma has an impact on? How does it change our lives in really tough ways? But it's also really important for us to recognize that a lot of times when we're working with survivors with trauma, we're being exposed to a lot of positive things as well. We've all heard about vicarious trauma or secondary trauma, but a lot of times we're also being exposed to a lot of what I call vicarious resilience, which is you're building up that ability to cope with things in life that are challenging because you're seeing other people do it on a regular basis. So I promise it's not going to be all doom and gloom in my presentation, because I don't think that's a healthy place for our brains to live. So the first thing that I always like to do is kind of break down what is stress, and post-traumatic stress, because they all have the word stress in their title, but they're completely different things. So when we're talking about, sorry, I hit the button too quickly. When we're talking about stress, we're talking about something temporary, something that is close-ended. So if I have a big project at work that I'm working on, like a presentation for NAMI, I'm going to work on it for a specific period of time. That time is going to come and go, and the stress should go with it. Once the task is complete, it's something that should disappear. Most of us experience stress on a pretty regular basis. It's a pretty strong motivator. Most people would say that, they didn't hang up any paintings in their house until suddenly they had someone coming to visit, or they never bothered to clean out the garage until their partner bought a new car and they needed a place to put it. These are temporary things that we need to do some sort of task around to get rid of the stress. Traumatic stress comes from a trauma. I mean, it's right there in the title. It's related to a traumatic event happened and I'm having trouble metabolizing it, but it's also completely normal. So, this is by no means a comprehensive list of what is trauma. So, I always like to ask at this point, can you think of other traumas? And if so, can you just type them into the chat? Because I think that a lot of times trauma is in the eye of the beholder. A lot of the things on this list, we could all agree these are what we would call big T traumas. Everyone agrees. Physical abuse is traumatic. Terrorism is traumatic. Most people would agree that an earthquake or a tornado is traumatic. But there's a lot of smaller T's that is kind of in the eye of the beholder. So for me, moving to a completely new house is stressful. I don't particularly want to do it, but it's something that I know how to handle. I've got a 6-year-old and a 5-year-old in my house. Probably it would be stressful for them as well, but it might also be traumatic, depending on how they're doing, what's going on in their lives, where we're moving to. Children have a very different perspective when it comes to things like moving. I think that there's also those things that we pretend are little T traumas that are big T traumas, like losing a pet. Most people would agree if you lose a partner or a family member, that's definitely traumatic. But a lot of us like to minimize how much we're impacted by losing our pets. And the truth is, that can be a huge trauma that people carry around. I've had a lot of survivors tell me that the assault that they experienced was, of course, traumatic, but the more traumatic thing was disclosing to a family member that maybe had a negative reaction or being afraid to go and report it. So it's all that kind of stuff that is in our personal experience of what is trauma. And I see a lot of good sharing going on in the chat. I appreciate that. I try to keep this going as much as I can. I know that we're all pretty used to just sitting and watching presentations now, but I get the most out of presentations where I actually get to do something. So I try to put that into mine as well. So traumatic stress, symptoms that start after the traumatic event. It's not like you were having these experiences before the trauma happened. So if I'm driving down the street and someone hits my car, I'm going to have normal responses to that trauma. I might have a nightmare that night about being in a car accident. I might sometimes tense up when I think about getting in my car again. I might feel really jumpy if I'm thinking about driving. I might be really jumpy the next few times I go down that specific road, even if it's a nice day, even if no one else is driving. It's my body remembering something negative happened here. The easiest way that I can think of to explain this is every single one of us has had the experience of eating something and a little while later getting sick and vomiting. Usually, when that happens, our brain says, oh, that food is poison now. You can get past it. It's not like you're never going to be able to eat chicken nuggets or whatever it was again, but it's going to take some work. And you might always just have that initial response of like, "Mm, that's not good because your body does a good job of remembering, and so does your brain. Again, these are normal symptoms. These are what I would expect almost anybody to experience a couple of days or even a couple of weeks after a traumatic event happens. So, this is where I talk a little bit about the brain. I promise I'm not going to get any science words in here. There's one word that I'll say, but the rest of it is all just descriptors. So, this is your brain. I do this spiel with 5 and 6-year-old kids to help them understand how their brain works. So I guarantee if they can understand how their brain works, you can get it too, even if you hate science. So you've got the top part of your brain, middle part of your brain, and then your brain stem, which is the part that runs down the back of your neck. Again, this is about as sciencey as we get. Top part of the brain is the thinking part of the brain. This is the part of your brain that considers options and makes decisions. So if I'm driving down the street and I see a cop car come up behind me with its lights flashing, I make a quick decision. Am I going to slowly put on my blinker and pull over to the side of the road and sit there with my hands in the 2 and 10 position? And when the person comes up, say, "Gee, officer, what seems to be the problem?" Or, depending on my experiences with police officers, am I going to drive somewhere where I feel safer talking to this person? Do I maybe have something that I think the police are going to get me for because I did something that was illegal? Maybe I'm going to start driving for the border. That's what is going on up here when the police cars start flashing behind me. This is the thinking, logical part of your brain. This part of your brain takes a long time to build. It's not completely done until you're about 25 years old. And I'm going to say that number again, 25 years old. And I like to repeat that because teenagers don't have this part of their brain completed. Anybody that loves teenagers, has a teenager, has worked with teenagers, has that experience of thinking you are just a very tall toddler. That's exactly correct. This part of their brain isn't done yet. It's not done until they're out of college. So it's one of the reasons why they make decisions that sometimes seem really illogical. This is the logical part of the brain. The middle part of the brain is your thinking, is your feeling part of your brain. This is the part that has all of the emotions. So I said I have a 5 and a 6-year-old at home. If I give them the blue cup and they asked for the green cup, that might be a meltdown. That might be about 5 minutes of my life trying to calm someone down because I gave them a cup that's a useful cup, a usable cup, but the wrong color because they don't have the logical part of their brain constructed yet. And that can get frustrated for me as someone that has the entire brain built. But I also understand you can't just think to yourself, oh, maybe the cup is dirty. It looks like the dishwasher is full. Oh, maybe I could ask mommy nicely, can she wash the cup so I can have the color that I want? No, I've got an emotional part of the brain. And so I just go, I wanted the blue one. And I start having a meltdown. That's the emotional part reacting. This part of the brain cannot think. It cannot make decisions that are organized. It has that split second to decide what to do. This is the part of your brain where your fight flight response lives. Most of us have heard of that. So a good example of this is if I'm walking across the street and I hear a car horn honk, I don't want the thinking part of my brain to take over at that point because this is what thinking brain would do. Ooh, a car horn honked. I wonder if that car is anywhere near me. Were they honking at me? Am I in the way? Should I go back to the sidewalk? Maybe it would be quicker if I run across the street to the other sidewalk. Maybe it's not even someone that's talking to me. By the time that thinking brain has weighed all the options and evidence, I'm hit by that car. This is the part of the brain that I want working when a car horn honks, the fight flight response. Now, probably I'm not going to try to fight the car. Probably what's going to happen is my ears are going to register car horn honks, and I'm going to be back on the sidewalk that I was just stepping off of before I can even recognize what happened. Because this part of my brain said, run, get to safety. Now, maybe a few seconds later, I'm going to realize, oh, that car wasn't anywhere near me, or maybe it was just a friend saying hello. But your brain is set to keep you alive. That is its default. Keep you alive. Better to feel silly because the car wasn't anywhere near you than to be dead because you spent too long thinking about it. This part of the brain has the one science word I'm going to say. It's where my thumb is. It's the amygdala. The amygdala has one job and one job only, and that's to tell you it thinks you are in danger. Well, feels you are in danger, since this is the thinking part. That's a really important part of the brain. But also, I want you to hear what I'm saying. It's not telling you are in danger, it feels you may be in danger. We want that part of the brain to have that big reaction, again, to keep us alive, but it's not the most able to recognize what's actually dangerous and what it just thinks is dangerous. So think of your amygdala like one of your doorknob cameras that you have. It's going to tell you when someone's dropping off an Amazon package. It's going to tell you if a stranger has come up to your door. It's going to tell you that it's a windy day in Cleveland. It's going to tell you when the snow is falling. That was when I turned off the alerts on my phone. I don't like to have that little bzz of panic that, oh gosh, someone's at my door, but I especially don't want to have it every time a snowflake is falling. That's your amygdala. Your amygdala is like one of those cameras. It's going to tell you, oh, there was a noise at the window. Maybe there's an intruder. Maybe it was just the wind. Maybe it's a cat. Who knows? So that's this part of the brain. It's going to keep you alive, and it is not good at communicating with the logical part of the brain. When your brain starts to feel like you're in danger and the amygdala turns on, exactly what I did with my hand happens. We've all heard that expression, I flipped my lid. That's literally what's going on in your brain. The top part of your brain that thinks flipped open. Not there anymore. You just have the emotional part now. Later, this part of the brain will come back, but it takes time for your brain to get itself squared away, especially if it turns out you actually were in danger. If we're just talking about car horn honking, I jump back on the sidewalk, I'm fine, I might feel a little jangly for a moment or two, but probably as soon as I start walking, this part of my brain comes back. And by the time that I've gotten to the other side of the street for real this time, this part of my brain is fine. This part is calmed down. Now, if your brain starts to get overwhelmed because the emotions it's experiencing are too big, or because you cannot run away, or you cannot be big and scary and try to fight back, the emotional part of your brain turns off too. And the only thing that's left to you then is your brainstem. Your brainstem is awesome at doing what it does, but it does things like tell you to breathe in and out without thinking about it, make your heart beat, digest food. It keeps all the systems functioning. Think of this as your reptilian brain. This is the part of your brain that keeps you going. Not great in a crisis situation, though. The only thing that this part of your brain can do when it feels like it's in a stressful situation is the freeze response, or in a lot of humans, we call that the fawn response. And the way that can look is it can look very much like, deer in headlights. You just kind of freeze and hope that the big scary thing goes away. But with most humans, we just have a feeling of, I was not in my body. My body felt numb. It's like I was up there on the ceiling watching what I was doing, but I wasn't there for it. Or you're going along with things. Think about how scared you have to be for this part of your brain to turn off and this part to shut down. You have to be pretty scared, which means that if it's a person scaring you, usually your best response, because you're in this frozen, I can't really react, I can't really run away section of your brain, is I'm just going to go along with what this person is telling me to do. So if someone comes up to me with a gun, I'm probably going straight into this mode. This part of my brain is gone because I'm going, this person is scary. They have a weapon. They could harm me. Better to be alive and traumatized and have to deal with that afterwards than to be dead because maybe I made the wrong choice and I made this person upset. It's really tough. And it's really tough for people that have gone through a trauma to understand you're not crazy. You didn't do something wrong. You didn't pick the wrong option. This is the only option that was left. That's all that you could do. So when people tell me, oh yeah, if someone tried to assault me, I would just grab a lamp and I'd smash it over their head, and then I'd take off my belt and I would wrap it around their legs and I would call the cops. Yeah, in my dreams, that's how I would react. I would love to be Wonder Woman and do that. I'm not trained to do that. I haven't had that training. I'm a therapist by training. I sit and I talk about how people feel and what their problems are. So I know that fight part of my brain, probably not the biggest part. Probably this part with all the words and the thinking is the biggest part. It's really hard for people to understand your brain turns off and takes a while to turn back on. When you go through a trauma, whether it was a real trauma or not, I can't say that enough. Whether it was something that you thought you were going to be harmed or you were actually harmed, your brain goes through this response. And then it can take about 4 or 5 days for your brain to turn back on to the point where you can think and make logical decisions again. And if this is the only thing that you get from my whole presentation, then I feel like I've done my job well. Because if people can understand how the brain works, they're a lot more forgiving to themselves and the people around them when we make choices that seem really illogical and irrational. The best way that I have of explaining the impact this has in an ongoing way with your brain is thinking about a big superhighway. This is what the highway should look like when your brain is working. This is typical conditions. You've got an 8-lane highway on both sides. Your brain sees what's happening, looks at the situation, processes all the options, looks at what's going on, makes a plan, and then acts. So I was driving yesterday when it was dumping down buckets of snow. I could see way down the road, probably about half a mile down the road in front of me, there was an accident in my lane. I was able to gently pump my brakes, be really grateful that I had put the snow tires on the car and hadn't taken them off yet, swerve a little bit to the left, and very slowly approach the accident and go around it and then get back into my lane. I made a whole plan there. I acted on it. It worked out just fine because the thinking part of my brain was working. If that accident had been 10 feet in front of me because it just happened, I probably don't have time for that. I'm probably not going to react that smoothly. Now, the way that highways are built, there's express routes, right? If there's an accident 5 miles down the highway, we don't want the ambulance and the EMTs and everyone having to weave in and out of typical traffic. We want them to go around. That's what the express route on highways is for. And that's what this part of our brain is for. This is the thinking part. But again, you don't want it to think when you're in danger, even if it turns out you're not in danger. You want to observe there's something going on, interpret the event as threatening, and react. I'm running away, I'm making myself big and scary and fighting back, or if things are really too challenging, I'm gonna freeze. And then I get to the action. I'm picking that response and acting. But again, it's not a choice. It's not like I say, let me freeze up. If people go through situations where they feel threatened too many times, even if they haven't actually been harmed, I can't say that enough, even if they haven't been harmed, this becomes the norm. Instead of having the let me think about my options, let me process my options, let me plan, and then let me act, it just goes straight to fight, flight, or freeze every time that something becomes challenging. So when someone talks about, I got triggered and I had a big reaction, that's exactly what happened. I stepped into a room. It was just me and a man that I didn't know. And even though this man did nothing threatening to me except exist in the same room that I was in and be a stranger, my brain defaulted to danger, danger, Will Robinson. That amygdala kicked on and said, this person could harm you. They are a threat. And so I left the room right away, or I yelled at them, or I made myself big and confrontational, or whatever it is that is my default. That's what happens when your brain goes through this one too many times. And that's what happens right after a trauma as well. If I had the car accident that I talked about before, where I was driving down the road and maybe someone smashed into me, and I had that response for a couple of days of like, I feel panicked when I think about being in the car, maybe I freeze up, maybe I get tense. I'm going to have that for a couple of days and then it should clear out. But maybe not. Maybe I'm driving in places where it feels really unsafe all the time, or the accident was really bad and I walked away from it okay, but I'm still struggling with feeling like it's safe in the car. And so I'm driving erratically and I'm worried about everyone around me. That's what being triggered is. It means that your brain keeps shutting down and responding as if you were in that dangerous, threatening situation all over again, even if you're not. And that's what PTSD is, post-traumatic stress disorder. It's when I've had these same reactions that go with every trauma almost every human experiences, but they last for more than a month. They can come out years and years and years later. Because sometimes when our brain goes into shutdown mode and goes into that survival mode, it takes those emotions and basically tucks them away somewhere. Your brain basically says, this is too big, this is too scary. You don't need to think about this. You don't need to feel about this. Let's just put this away so that you can live your normally scheduled life. But then maybe 3 or 4 years later, I'm still struggling with relationships, or I feel like I can't concentrate, or I'm having trouble holding down a job, or my kid is the same age that I was when something stressful happened. It's really easy to have those things come up years later, especially if I didn't get to process it in the first place. Maybe I didn't have people that were supportive in my life. Maybe I didn't feel like I had the space to actually deal with this traumatic thing that happened. I had people ask me a couple of months ago, hey, when people come and report a crime months or years later, why? Why aren't they reporting it right away? Maybe they didn't have that mental capacity to go through the justice system. Maybe they were afraid about telling someone what happened or that they wouldn't be believed, and they just didn't have that space to have any of those problems because they just went through a trauma and they're trying to just get back to their normal life. Years and years and years ago, there was something that was done called the ACEs study. And ACEs stands for Adverse Childhood Experiences Scores. And this was looking specifically at if you went through negative things that could have an adverse impact on your development as a child, how likely were you to struggle later in life as a result of them? Um, the ACEs that they were looking at, the adverse experiences, are on the left. The things that could be impacted are on the right. So the things that you might have as a result of having experienced an adverse experience. Um, I think that this is a perfectly fine study. There's a lot of things that in the last few decades we've pointed out they should have included. So they've been updating the study. I know that it's something that's still going on, but they left out things like, racism, having to live in a different home, having the significant loss of someone that cared for you. So they left out a lot of things. You're not going to see things like bullying in the original ACEs study. They were just looking at what's going on in these things. And then what are the things that we see are higher? And one of the things that they really noticed was higher was that you might have negative behaviors, things like alcoholism, drug use, struggling to hold down a job, struggling with feeling like you can connect with people. You are also going to have a lot of physical health issues. And I want to point out it's not because I was in a household that was neglectful. And so that gave me some sort of heart disease. No, it's I went through this experience. The experience didn't cause me to have the physical problems, but I'm more likely to have physical illness because of it. So I have a polling question here, just because I like this to be a part where people get a little bit involved. How many of the top 10 leading causes of death, including respiratory and heart diseases, cancer, and suicide, are associated with people having an ACE score of just 1 or more, which means you might have had one negative experience when you were a child? I'm going to let people just pop that into the chat. I'll give just a few moments for people to put their answers in, but I've given you a couple of different options to choose from.
A lot of people guessing 8.
Thanks, Matt. It's hard for me to keep track of all the numbers as they come in. So the answer to this is 5. 5 of the top 10 leading causes of death are associated with having just an ACE of 1 or more. Again, not very much. It's not like you need to have had the roughest, hardest life that we can imagine for a child. We found that people that have any type of adverse childhood experience are at higher risk for heart, lung, and liver disease, obesity, diabetes, depression, and substance use. And again, I really can't hammer this point home enough. It is not that the experience caused the disease. It is not that the experience caused the diabetes. It is just I had this happen in my life, and this is one of the impact. And the study found that almost 2/3 of the people that were surveyed had experienced at least one event in their life. The specific numbers are that only 36% of the population experienced no event of any type that was negative in their life. And I'm willing to bet that if we went back and did that study again with some of the newer ACEs they're including, those numbers would shift a little bit. We all know it's very hard to make it all the way into adulthood without having any type of trauma happen. Um, 26% of the people screened had one ACE, 16% had two, 9% had three, and then 12% had four or more. That's a lot. And we know that this is taxing on all of our systems, on the medical systems, on the mental health systems, on educational systems. So it's something that I always like to include and have people just be aware. It doesn't take a big thing. It doesn't take multiple things to have an ongoing impact because we know our brain, our body, our spirit, everything is all connected. It's all folded together. And a lot of times, if we don't get that help and that support that we need, it has that ongoing negative impact. I always think that this is a really important point when it comes to childhood trauma. If I have something happen to me now, I'm 40, I know who I am. I mean, most of the time, as much as anybody can. I have an idea of who I am as a person. I have my support systems. I have my life built around me. I have my ways of coping with things that are challenging. Think about a child that you love. If you have a child that you think about, how much do they really know about themselves, about the world? I mean, they're little geniuses inside tiny bodies, but they're still trying to figure out everything around them. If they go through a trauma, that changes their view of themselves, of other people, of the world at large, and it makes them feel powerless. And most kids would tell you they don't feel like they have a lot of control anyway. I know that every adult that has kids would say, oh, they have all the power in the household. No, they don't. They don't get to decide whether or not they're going to school most of the time, or what you're buying to cook for dinner that night, or what time their bedtime is. Kids don't have a lot of power. And so going through a trauma, that takes away their ability to make choices and to feel in control even more than they already do. I think that this is how it feels sometimes when you're a human in the world, knowing that there are bad things around you. And sometimes you just have to convince yourself, no, everything is going great. This is how I keep going forward day after day. So I said at the beginning, I've worked at the Rape Crisis Center for over 11 years now. I like this job. I like what I do. It makes me happy all the time. And that's in large part because, yeah, I could pay attention to the fact that the world is on fire behind me. I know it is. It's not like I'm unaware that there are people being assaulted right now while we're talking. I'm going to focus on the things that are going well a lot of times. And I'm not going to ignore that fire behind me. I'm going to put it out. But I'm also going to recognize sometimes I got to look ahead and I got to look at the things that are going well and what's going right. But it also feels a little bit like maybe I'm being willfully oblivious to what's going on around me. So, traumatic memory is stored really differently from regular memory. If you've ever seen the kids' movie Inside Out, I highly recommend it. They clearly had some neuropsychologists that worked with them on that script. It's very well written. Um, Traumatic memory is different from regular memory. Regular memory, I have an event, I process the event, I have my feelings about the event. That event, while I'm sleeping, gets stored somewhere in long term memory so that the next day I can remember how to play the guitar that I just picked up yesterday. I have, in fact, a little better abilities of being able to get my fingers into the right place and pick the strings in the way that feels comfortable to me. That's a normal memory. Traumatic memories don't get stored that way because the emotional part of the memory is so big that it keeps turning the brain off. Usually, when you go to sleep, you close your eyes and your brain does this little Christmas tree light up dance where it's sending the information back and forth from the right side to the left side. And once it figures out where it goes, it picks that up and it puts it away in that box, kind of like apps on your phone. It's putting everything into the correct category. If it needs a whole new category, it'll make one. If I'm learning how to play guitar, it's going to make a new box for that. But with traumatic memories, when your brain tries to process that memory, the little amygdala dude that lives right in the middle of your brain stops it because it doesn't know that you are asleep and safe. It just knows big, strong emotion, danger. And so when your brain tries to put that memory away at the end of the day, it turns off the part of your brain that processes stuff. So it's like the memories are basically clogged up in your brain, not able to be processed, which means that the memory itself is out of order. So if I asked you, sit down, write out your morning for me so far. I want you to write from when you woke up to right now. Put everything into order, make it as logical as possible. Probably most of you are going to have a pretty narrative morning. I woke up, I took a shower, I got dressed, I ate eggs. I thought that the sausage was a little bit burnt, but it was okay and I was hungry, so I ate it anyway. I came, I sat down, I watched this brilliant presenter, whatever. That's going to be a typical memory. That's going to be a typical narrative of your day. With a traumatic memory, it's more like instead of giving you a piece of paper and a pencil, I gave you 60 different post-it notepads, different shapes, different sizes, different colors. And I said, use all of these to write down what happened to you. And then I took all of the post-its you had written on and I hid them all over the room. And I said, great, now you should go find them and try to make a story out of them. Make the story of what happened. You're not going to be able to do it. There's going to be some post-its you might never find. Those are parts of the memory that might just be gone because when your brain turns off, it stops recording. The part of your brain that records memories is this top part. We are very visual, we're very verbal. The first thing on your brain that turns off when you're in a dangerous situation, words. Words turn off immediately, which is why a lot of people, when they're trying to talk about traumas, will say, it's like I can't put it into words. I can't tell you what happened. Yeah, you're right. You can't. That part of your brain turned off. You might never have the words for it. If we have our little post-it note pile, you might be able to put some things into order, but you also might go, I don't know how I got from the mall to my mom's house. In fact, I'm not even sure that was the right day. Maybe these are two separate days. You might find a post-it note that has just a single word, laser. Why does this say laser? What does that mean? It's really hard to put everything together. It's very fragmented. So it's one of the things that I always like people to understand, especially if they're trying to report a trauma to someone, either in therapy or because they're going to the police officers or something like that. It's not going to sound linear. It's not going to make a lot of sense. There's going to be times where years later you go, oh, I actually do remember how these events line up. I can actually put these two moments together. That's probably because part of your brain healed enough and processed enough that it was able to say, aha, here's another piece of the puzzle. It's frustrating. There's almost nothing that you can do about it other than try to work with yourself and be patient with yourself. It's one of the big things that we do in therapy. We have a lot of different ways of trying to sort through traumatic memories. We also recognize that not everybody wants to do that. It's not healing for everyone. And that sometimes it's going to be the opposite effect, that if you try to touch the traumatic memory, it's just going to make everything worse. So it's something that I always tell people, your brain knows what it's doing. It's going to pull things out when it's ready to deal with them. And if it's not ready, that's okay. It might come later. So again, this is just really looking at what happens when your brain is triggered. And really it comes down to there's something that reminds you of the past. It could be a smell, a sound, someone touching me on the shoulder. Little. It doesn't have to be a big thing. It doesn't have to be someone invading my space and trying to harm me again. It could be tiny. The alarm system in your brain gets activated, that amygdala turns on and says, oh gosh, danger, and then responds as though you are actually still in danger. This is important to recognize when you're working with anybody that has had a trauma in their past. A lot of times when people have a past trauma, they're being told by people around them, you're acting like you're still in danger. You're not in danger. I'm a safe person. Sometimes that's what they know, but they don't know that. They can't feel that in their brain. And it's really important to keep that in mind because otherwise we start treating people like they have real issues, like they are the problem. traumas aren't supposed to happen. Like trauma is an event that wasn't supposed to occur. I'm supposed to be able to walk down the street without having a piano fall on me. If a piano falls on me, that's a trauma. Traumas are abnormal events. The way that we react to them is totally normal. That's why I had that list in the beginning of this is how all humans respond to trauma. It's really important to keep in mind if someone has been through a trauma or many traumas, they might have a lot of things that they have trouble dealing with because it might seem like a little deal. It's a big deal to them. So I think this came up a lot in the pandemic. Um, you know, people are going through life. They've already got their big trauma pile on their back that they're carrying. Now they have stress and anxiety, and maybe they have some mental health issues because of the traumas they've experienced. And then we put a worldwide pandemic right on top of that, more fear and anxiety. If you then put a teeny tiny little obstacle in that person's path, of course they're going to react like it's the end of the world. It might not seem like the end of the world to me that the deli was out of chicken salad that day. To them, it is the last straw. They're already carrying too much. And that's really important to keep in mind. Those trauma responses keep living in the brain until you've processed the trauma, made sense of it, and put it away. And I think that for most of us, that is a lifelong thing that we're dealing with. So one of the things that I always like to check in on is when it comes to childhood sexual abuse, how often do we think the child knows their perpetrator? The media tells us one narrative, but in reality, how often do you think the child that's being harmed knows the person that's harming them? Go ahead and just pop it into the chat. I gave you a couple of options again to choose from.
Got a lot of people guessing either 93% or 70%.
Good. That tells me that I'm with a pretty savvy bunch of people, and I appreciate that. Because the narrative that the media gives us is child walking on a street or down a dark alley, and someone in a ski mask with a knife or a lead pipe or something jumps out and attacks them or throws them in a van and takes them away. Really doesn't happen very often. I'm not going to say never. Okay, it does happen sometimes. We all know that there are people out in the world that are harmful and that are dangerous, but it's pretty rare. And I can actually tell you that the number of times that I heard that story over the course of working just at the Rape Crisis Center, I think I can still count on one hand the number of times that I had a child or an adult come to me and say that that was their experience. The answer to this question is 93% of the time. People that are kids that have been through some sort of sexual violence know the person and usually know them very well. It's usually someone that's trusted. It's a family member. It's a member of an organization that they go to, whether it's religious or community based or sports based. It's a teacher. It's the people around them. And I put that out there not to depress people because I know what a depressing statistic that is, but because I think that it's really important for people to recognize this is an extra level of the trauma. If I had someone rip me off the street and assault me, yes, that's a trauma, and I'm going to have trouble with that. It's going to be different if it's someone that I know, that I love, that maybe was the person I would go to if I had something bad happen to me. Now my whole world is flipped upside down. And that goes into that development of the brain as well. Because now it turns out my dad that I'm supposed to trust is not trustworthy. My priest or my rabbi or my coach, that's someone that I can't turn to anymore. And a lot of times kids already feel that sense of isolation. And I think especially with the pandemic, this was an important thing for people to keep in mind. Kids go through things with the people that they love and they're supposed to take care of them. I think that this is such a true statistic when it comes to all types of childhood abuse, not just sexual abuse. The people that are going to harm them, it's the people that they live with, the people that they depend on. And so then we throw something like the isolation of the pandemic in there and not being able to talk to their friends and not being able to have that normal school experience. It's leading to those higher rates that we're seeing in the mental health that kids are struggling with and the depression, anxiety. And I think that a lot of times it's really easy to get caught up like I said, in the vicarious trauma, in that soul weariness, because we're doing a lot when we try to take care of other people. We're doing a lot when we're carrying other people's trauma. I've been doing this for a lot of years, and I do it because I love doing it, but I also spent a lot of time figuring out how do I protect me while I'm doing this type of work. So, the best example I can think of for how you're impacted by hearing about traumatic events or just by having negative things happening in your worldview is something that we call the window of tolerance. Window of tolerance is really just how much can I put up with in my day, and how do I usually respond when negative things happen in my life? The window of tolerance is not, I am the Dalai Lama, I am perfectly grounded, I am able to cope with anything that's frustrating. I'm going to guess even he sometimes gets frustrated, right? He's a human, he has emotions just like the rest of us. A lot of the stories that I've heard about Mr. Rogers, very calm, very put together person, did a lot of self care because he recognized, yeah, I've got angry emotions too. That's why he could talk to kids about what do you do when you feel mad. Window of tolerance. How much can I deal with and how do I deal with? So, when I think about something negative that's happening to me, I'm asking myself, am I able to stay level and deal with this annoyance? Am I exploding like a volcano? Or am I maybe shutting down? Good example that I heard about this is imagine that you open a refrigerator. When you open the refrigerator, you have a gallon of milk on the very top shelf. The top of it falls off, and somehow the entire thing tips over, and milk goes from the top of your fridge all the way down, all over the shelves, all over your leftovers, all the way down into the vegetable crisper and the fruit drawer. I mean, you've just got milk everywhere. The window of tolerance does not say that I'm going to be like, yay, milk, a big mess to clean up. That is absolutely not how I'm going to respond. I think that it would be nice if we could all respond that way to all obstacles in life, but most of us can't. I can't. If that happens, I'm probably going to do a big sigh. I'm going to say a couple of curse words. I might get a little loud for a moment or two. And then I'm gonna pull everything out of the fridge. I'm gonna get the rags, I'm gonna get the soap, I'm gonna push my sleeves up, I'm gonna get Lysol wipes, I'm gonna just clean everything. I'm gonna sponge off the apples and the oranges. I'm gonna throw away the lettuce because once lettuce gets wet, it's just done for. I'm going to clean everything up. I'm gonna put it away. And then I'm gonna go back about my day. I'm gonna change my clothes to get the milk off. That's it. That's when my window of tolerance is normal. I might mention it to one or two people, but probably it's kind of just gone by the end of the day because I've had other things that have come up during the day that are more positive or more negative than that. Now, if my window of tolerance is small and I'm the type of person that turns into a volcano and explodes or erupts, when that milk spills, before it even finishes going all the way down to the fruit drawer, I'm already shouting about it. I am exploding. I am blaming everyone around me, even if there's no one around me. If I live with people, it's all their fault. It's my husband's fault. Why is the milk on the top shelf? I always tell you to put it in the door. How come you couldn't close it properly? If I clean, I am angry cleaning. And angry cleaning is not effective cleaning. It is basically me slooshing the milk out of the fridge onto the floor, throwing away the lettuce, slamming around. Probably I don't actually clean the refrigerator very well. Like I don't probably get all the milk out from in between the crevices. And if you've ever had milk spill, then about 2 or 3 days it's going to start to smell super funky in there if you didn't get it all out. Which means that in 2 or 3 days, if my window of tolerance is still this small and I'm still a volcano, I'm going to go back to screaming about this again. Every person I bump into that day is going to hear about this milk. The people I work with, my friends, the checkout person at CVS, everybody is going to hear this story about the milk spilling because my window of tolerance is too small. I can't deal with this. This is one more thing I have to deal with, and I already had a window that was this tiny. Now, if my window is that tiny and I'm someone that numbs out, that shuts down, that's going to look a little different. I always think about when my kids were teeny and I was incredibly sleep deprived. Normally, if my window of tolerance is small, I'm a volcano person. I shout, I get loud. When my kids were teeny and I had no sleep, I would have just laid down in the milk on the floor. I would have cried. I would have sobbed because I couldn't deal with it. I was too exhausted and I didn't even have the emotional wherewithal to be explosive about it. I just cried or shut down. If you do any type of cleaning with this, it's going to be really sad cleaning, like you're not going to be very effective. Probably you're not even going to see all the places the milk got to. At some point, you will probably cry over the fact that you are literally crying over spilled milk. You might not remember that you laid down in the milk. So you might be walking around with funky milk smelling clothes all day. If you remembered to change your shirt, you probably didn't remember to clean off your body with the milk on it. And so again, you're going to smell kind of funky. It's just that idea of how much can I deal with? And a lot of times when we're dealing with people that have been through traumas, this is an important thing to keep in mind. So when I see someone ahead of me in the grocery store flipping out about something that sounds like a small deal, I'm usually thinking of their window. I'm going, ooh, I wonder what happened in their day because that window is awfully small. It's not the cashier's fault that there's no more Oreos in the store, but this person can't handle that. They needed those Oreos to get that window even just a little bigger. And it's really important to keep in mind that this is the kind of stuff that we need to keep in mind when we're trying to help people, because people that have no window of tolerance, that have a lot of traumas, don't have good boundaries. They're not able to have good boundaries. Having boundaries is something we do when we're healthy, when we have a lot of energy, when we have the ability to say yes or no to things. And sometimes we think that we're helping people when we merge with them so that their problems and our problems become one. If I have a client that I'm helping and that client starts following me home mentally from work, that's never a good thing. I'm not helping them by carrying them home with me or stressing about their lives. It's not helpful for them, for me to think, oh, I can't be better until this person is better. And this is especially true for caregivers. You need to be able to say, this person's choice, this person's ability to do things or not do things, how successful they are, that's not my life. That is their life. I need to be able to walk alongside of them. I need to be able to join them on their journey, not merge with them. Because when we merge and those boundaries get really blurry, that's not healthy for us or for them. It's all about, I need to be able to be present with this person. I need to be able to sit with them in whatever their experience. It's not like I'm sitting there with clients going, oh, can you stop crying? You've been crying about this for the last 4 or 5 sessions. I mean, don't you think you should be over it by now? No, I need to be able to sit with them in that place of loss and grief and pain and not say, I'm going to pick up your pain and carry it for you. It's not mine. It's not my experience. It's not my story. It's theirs. So I need to be able to be with them in that present to be able to help them carry their load. It's not up to me to join with them and to feel like this is my life now. And I think that this is really beautifully illustrated with this. If someone is struggling, I can't just take their burden away from them. And if this person genuinely cares about me, they don't want me to take their burden away from them. They just want help dealing with the burden. It's very different for me to say, let me help you carry one end of that. Or even, I've had to say this to the clients many times in my life, I'm not the right person to help you lift this. So a good example of this is eating disorders. We have a lot of clients that come to our doors that have disordered eating as a result of the trauma they experienced. I have some experience supporting that. That is not a certification that I have. That's not a specialization that I have. And so that's a moment where I'm going to say, we need to get someone else to help us. It's not just going to be the two of us carrying this big, heavy load. We're going to get a third person or a fourth person in here because more people carrying is always going to be more helpful. Okay, this is my final polling question. So we know that the numbers are low for people reporting crimes, but especially sexual assaults. Out of 1,000 sexual assaults, how many do you think are reported to the police over the course of a lifetime? And I always like to tell people it might take people about 4 or 5 years on average to report to the police, but out of any that they experience, what do you think the numbers are?
Everybody's guessing 310 or 515.
Good job. Again, I knew this was a pretty savvy bunch that I'm presenting to. So the number is 310. About 1 in 4 are going to be reported. It's an incredibly low number. I think that number is actually a little soft sometimes. Sometimes it's not the person's choice to have reported it. Some of these numbers that are reported are because the hospital has to report. People that work with kids are mandated reporters, but it's a pretty low number. And it's an even lower number for the people that are actually going to ever see the inside of a courtroom after they report. And I think that's an important thing to keep in mind because it means there's a big part of the population that has this experience that never told anyone, that maybe is telling you or me for the first time, that didn't get the closure of feeling like they got some sort of justice or they understand or they got something that helped them heal and move forward. The last thing that I really want to go over, because I want to leave some time for question, is just stages of change. Everybody changes at their own pace, but a lot of times, oh, stop that. A lot of times, we think that people need to be able to change a little bit more quickly than they actually can. So that fourth step, the action phase, that's where therapists live. We are ready. We are ready to take steps. We know the steps. We've gone over the steps with many people. But for a lot of people that maybe are just now trying to get through the changes in their life or starting to recognize that there's a problem, there's steps that go before that. Think about when it's New Year's Eve and everybody says that they're going to drop 30 pounds and eat healthy and get to the gym 5 times a week. That's really just kind of jumping into the action phase. You actually have to do some planning before that. You need to actually understand, hey, I can't get to the gym more than once a week because I don't have a schedule that allows for it. Is there another way that I could do that? Could I maybe take a walk at work? I need to be able to understand, I don't actually like most vegetables and fruits. So I need to do some planning. I need to actually do some things to figure out how am I going to make this change happen? And for a lot of our clients and a lot of the people that we love, they're going to jump from maybe there's a problem or someone told me there's a problem to I'm trying to fix everything. And then as soon as there's an obstacle, I'm back at the beginning. There's no problem. There's nothing that I need to change. I'm happy with myself the way that I am. It's really hard to make changes. All humans struggle with this. If it was easy, we would make changes very quickly. We wouldn't have to set New Year's resolutions. We wouldn't have to set intentions, but it's really hard. And it takes time to recognize what are all the obstacles that I might bump up against, even as I'm going through those changes. And then how do I deal with them? How do I hit that transcendent phase of I understand why this was my go-to when things were stressful before, but I'm not going to go back to them because I have so many other things that can support me. And I think a lot of times when people are thinking about change, they really just want the world around them to change. I get that. I want that. I've got a 5 and a 6-year-old. I love them. I would like it if they never yelled at me again and if they could stop throwing things. I'm going to guess that even if a magic fairy came down tonight and made that the new reality, I'm still sometimes going to get frustrated at them. They're still sometimes going to get frustrated at me. It's not going to be simple because it's not about just making the world around us change. It's about us being able to change how we're responding to it and how we're feeling about it. So I'm just going to skip past these because I think that really, that covers the bulk of the presentation, and I want to give some space for questions if people have them. So again, this is just our little tag from the Rape Crisis Center. I'm going to just stop sharing so that I can actually see people's faces. And then if people have specific questions, they can either unmute, or I know Matt has been checking the chat. So I'm here and I know it's 1 o'clock. I'm going to hang out basically until everybody else leaves.
Thank you so much, Hester. I'm glad that we can extend this webinar just a little bit further in the event that there are any questions. Feel free to drop any questions you may have in the chat. Please also know that you will receive the slides, and you can view this webinar as a recording on our YouTube channel later this week. I am also going to drop in the chat the link for the survey. If you could take a moment to complete that. I just dropped the link in there. It's short, it's anonymous, but we do appreciate your honest feedback on our programs. So definitely take a moment to complete it before we finish. So just seeing a lot of nice comments in the chat that this was a great presentation, great information, very informative. Glad that you all feel that way. We're really just trying to offer webinars for you each month that address relevant topics. So glad to know it's been and helpful for you. We did get a question in here from Shannon asking, will any revisions to the ACEs study or the ACEs questionnaire include religious trauma?
That is a great question. Yes, my understanding is that that's being included now in the new ACEs study because that's something that they've recognized is a big factor for a lot of people. And the original ACEs studies was developed, I want to say back in the 60s. So I understand that there were things that they didn't think were important at the time, or that maybe they didn't realize how prevalent it was. So I know that's being constantly updated.
I got a couple more questions in here. One from Sarah asking, is it always necessary to discover what the trauma was when treating trauma? And what kind of therapy do you suggest to heal from complex PTSD or CPTSD?
Ooh, great questions. Okay, so the first question, is it necessary to find out what the trauma is? No. I've had a lot of people that I've worked with that have come to me and basically said, I don't know if anything happened, but I feel like there's something. There's something that's bothering me. You know, if your brain is ever able to remember, it will, but it might not. And I think that it's unfair to think that that you have to remember in order to heal from it. That's not how healing happens. Because if that's how healing happened, I would be able to just go into my therapist's office and give the story. This is the trauma that happened to me. This is what I remember about it. These are the details, and I would be fixed. And that's what it looks like in every movie and TV show when it comes to trauma. That doesn't work. That doesn't work at all. The trauma is still there because you still have the emotional impact. You still have that physical impact that it had on you. So there's a lot of different therapies that you can do, whether you know the trauma or not. A lot of the people at my agency are trained in EMDR, which is eye movement desensitization and reprocessing, which makes us sound like computers. But when you think about how the brain stores memories, what it's really doing is saying, we know these memories are stuck in this part of your brain. We're going to trick your brain into processing it while you're awake and in a place where you feel safe and comfortable so that it can clear it out. That's a good one for people that are ready to talk about and deal with their trauma narrative. And that's not everybody. And I've seen it go sideways. So I always tell people you might be doing years of therapy before you're telling your actual story. Again, you know, Hollywood makes it look like I go to my therapist twice, tell them the story, and I'm done. That's not it. We also do a lot of somatic experiencing, which is looking at how does the body store information and memory, because I might have processed the story of what happened or my emotions about what happened, but my body is still holding on to some of those trauma memories, um, especially when it comes to certain types of natural disasters. When 9/11 happened, people ran, and running gets your brain moving. It gets that bilateral stimulation going. So there was not a lot of PTSD that came out of that. Hurricane Katrina, lots of PTSD because everybody was trapped. Nobody could move, which means the brain can't process. So that's one of the pieces of somatic experiencing is how is your body storing this information? We also do a lot of therapies that are based around not speaking. So we do art therapies, play therapies, any type of acting or melodramatic, psychodramatic therapies. We have a lot of stuff that basically doesn't use any of the words because, like I said, the words turn off. It's useless. Like talk therapy is good when you've done all the other stuff, but it's one little piece. I always say, like, Freud did a great job getting the field started, but the field has advanced so much from just two people sitting in chairs talking to each other. It's really different. And I think that a lot of times when you can do a lot of those more creative therapies, it gets to that middle part of the brain, to that emotional part, and it processes stuff that you didn't even know. So I think that people that do a lot of writing or painting or drawing or walking or anything that's out in nature, you have these moments where you go, oh, well, I didn't know I still felt that way. Yeah, you didn't know, but you knew. So that answers that first part of the question. And then the second part of the question was really focused around like types of therapy. Those are the types that I usually recommend. Anything that's creative, and anything that fits for you. That's the important part. I like yoga. I don't really like to do a lot of body-based therapies when I'm going through a big problem because I need time to regulate my emotions. So I want to do things that are more creative and hands-on. But the yoga, where I'm just kind of like sitting in my body and noticing my body, makes my anxiety go, whoa, what's that about? Am I having a heart attack? I need to be able to be regulated with my emotions before I can do body work and go, ooh, yeah, thinking about that gets my heart going, but I know to expect that and that's okay and I can deal with it. So I always tell people it's not one size fits all. I'm really suspicious of any practitioner that says this is the one thing that I practice and it will fix you. No, because I've seen a lot of different things fix a lot of different clients. I've had a lot of clients that do really well with cognitive behavioral stuff where they're thinking about their behaviors and what their thoughts are and what they're telling themselves. I've had a lot of clients hate that type of therapy and want to do things that are more creative. So I always tell people we're going to throw a lot of spaghetti at the wall and see what sticks. And it's going to be different stuff on different days of the week. And that's okay. I think that as long as people know to expect that, they're willing to kind of go through that ride of what that looks like.
Wow. Thank
Thank
you.
you.
You're welcome.
Yeah, we have one final question. This one's from Kathleen, who asks, so you mentioned that hyperarousal and hypoarousal are not choices that people make. Can that change with time when people increase their windows of tolerance and or understand themselves and their reactions better?
That is such a great question. Yes, it can. It's very slow. I wish that it were faster. So I'm someone that has a very high startle response if there's noises. My kids have figured this out, and now I'm in trouble. They keep hiding and then jumping out and shouting "boo!" And my startle response is so high that even if I see them hiding, sometimes if they're loud enough, I still go "wah!" and jump and shriek. That is probably not ever going to change in me. I'm probably always going to have that's a fight response. As silly as it sounds, me jumping and screaming, that's a fight response. That's designed to scare away the threat. Now, since it's my kids, they just fall on the floor laughing. Like they're not going to scare away. But it's something that if I really started to pay attention to it and do work around it, probably I could get that response to shift. The shutdown response, where people are hypo aroused and they're so depressed they can't deal with it. A lot of times it's figuring out, okay, how do I get my body moving? How do I get my brain processing? How do I get just a little bit more energy to be able to say, okay, the milk spilled on the floor, it's all over the floor, and I want to sit down and cry. I'm going to give myself 10 minutes of feeling really lousy about this and just sobbing over this. And then I'm done. And I'm going to figure out how to put that away so that I'm actually done. I'm not just shoving it down and saying, don't be a baby and cry about it. I'm actually taking that response, giving myself space for that response, but then letting that response go. How do I give myself that space when I'm trapped in traffic to shout for a couple of seconds and get really mad? And then maybe say, well, instead of yelling at the cars, how about I turn up my music really loud? I'm still yelling, but I'm yelling along to a really good Zeppelin song now, so it's all okay. What is it that kind of engages that response and gives you tools to use? It's kind of like the old therapies of punching a pillow. I know that it's been really proven that like punching a pillow or just shouting and raging don't always do anything, but I think it's because people are getting trapped in the behavior. I'm still angry. I'm still punching the pillow. Okay, but am I doing something that engages parts of my brain and allows me to process that anger? Or am I just slamming my fist into a pillow and getting more and more worked up and angry? So, yeah, you can shift those things, but it definitely takes that mindfulness, that awareness, and also that patience. And I think that is the piece most humans lack. I lack it. I feel like I should be the most patient human being in the world. I'm a therapist. It should just be natural. That's not true. I know that's not true, but that's what my brain tells me when I'm being impatient about something. It takes time. It takes a lot of time. And there's always going to be things that trip it up. So when people are in recovery, for example, they might have coping skills for 99 out of 100 situations. And then there's that one situation that they didn't have a backup plan for that's going to make them get hypo or hyper aroused. That's okay. I always see those as learning moments where we go, oh, I just didn't know that that would be a barrier for me. I didn't know that would be a trigger and that would trip me off. And so it's that patience. It's really sitting with it and going, yep, I'm right back here again where I'm on the floor shouting because there's milk everywhere. let me figure out why today is different. Why was that reaction different when I've been practicing for so long?
Great questions and great answers. Just seeing a lot of very positive feedback again as we finish up here. Just one final reminder to complete. Oh, someone have a question?
May I ask a quick question?
Sure.
Yeah.
Okay. First of all, I want to say you're doing a great job. Thank you very much. I'm learning a lot.
Thank you.
So what's kind of encouraging is, I know that my emotions can just be off the chart, and my rational brain is fully aware of that. So long story short is, I know that I am not able to a lot of times I'm not able to get in touch with what was happening with me, but I know that it's coming from trauma. So it's very, very frustrating because, I can't process it during the day a lot of times, but then when I go to sleep at night, I have the nightmares, you know. So nightmares it's a hallmark for trauma survivors, So I guess in saying that, I've been in therapy and I'm always trying to process. So I just had last night I had a dream of something that was the actual situation that I actually needed to process. But I think that's positive because I am not making it out to be about Bugs Bunny or Donald Duck. I mean,
Yeah.
I'm actually making it out to be what is actually happening.
Oh, wait, Mary Lou, you muted yourself. Wait, Mary Lou, you're on mute.
Okay. Oh, okay. I just want to be able to walk into the pain and deal with it for what it is.
Mm-hmm.
So how do I do that better? I know this is what it's all about.
Yeah. So I always tell people, you're going to have to deal with the pain no matter what, right? You're
Right.
going to have to deal with it no matter what. It's kind of like self-care. I hear a lot of people say, I can't do self-care because it's selfish. You know what? If you don't take care of yourself, you're going to fall apart one way or the other. So you might as well
Right.
plan for it in the day. When it comes to dealing with trauma, some of the biggest things that I tell people are you want to get everything set up as if you're going to completely fall apart. So when we do fire drills in schools, it is not because we hope the building catches on fire. It is because if there's an emergency, we want kids to be able to respond appropriately. If my smoke alarm goes off, my kiddo is homesick from school today. If our smoke alarm goes off, I know he's going to jump up, he's going to run for the door and go out the door because he has been trained to do that. And I'm going to do that. If I'm in a strange building that I've never been in before and the smoke alarm goes off, I'm not sitting there in a panic going, oh God, I guess I just stay here and I burn with all the furniture. No, I'm going to say, ooh, where's the exit? Get down low, put something over my mouth, because we practiced, because I trained for that since I was little, because we never used to do that. And there were a lot of losses of young kids, unfortunately, in the past.
Right.
So it's the same thing when you're processing trauma. If I know that I'm going to be doing something tough, boy, I'm going to be super nice to myself that morning. I'm going to give myself the best breakfast in the world. I'm going to make sure I got enough sleep. If I didn't sleep well the night before, I'm not touching that trauma today because I'm not ready. I'm not ready. I need all of my resources there. If I'm running late to my therapy appointment and I come in 10 minutes late, nope. I'm not going to do any work around that trauma. I'm going to do things that are easier. I'm going to keep building up my skills. I'm going to have people that I can call after. I'm going to have things that I can use during. That's one of the ways that I've been able to be a therapist for this long and not burn out on it. I do a lot of self-care and a lot of containment of the things that people are bringing into the space, because otherwise I'm carrying that stuff home and I can't carry that stuff home. It has to stay in the office so that we're all safe.
Right.
And then a lot of times what I tell people when they have nightmares is setting your bedroom up so that when that nightmare happens, you are safe when you wake up from it. That's so crucial. I used to have people make signs that they would hang up in their bedrooms, either on the ceiling or on the walls. We would sometimes use like glow in the dark paint. We would have night lights that they would have. We would have different smells that they were diffusing for aromatherapy, whatever it was. But I always called them anchors. What are the things that when I wake up and my brain is still in that nightmare and I'm awake, makes me go, oh, I'm at home and I'm safe and everything is okay. And it might sound silly for someone that is a grown adult to have a sign across from their bed that says, you are home, you are safe, you are alone, whatever the signs were that they said. Let's be silly. Let's do the
Right,
thing.
right.
There
Yeah.
are, the basics work. I got frustrated the other day about, I don't even know what. And I picked up one of my kids' stuffed animals and I went, "Mm," and then as soon as I touched it, I went, oh, that's soft. That's nice. That's gentle. Yeah, we need to go back to the things that work when we're kids because it's working on these parts of our brain. This part of our brain is nice. It's helpful. It's what keeps us going. But this is not the part of the brain that hurts when I'm upset or when I have a nightmare. When I have a nightmare, that's probably all right here and right here. So I need to
Mhm.
do a lot of the stuff that feeds those parts of the brain specifically. Forget the words. Forget all the things about thinking, feeling, emotions, soft blankets, cuddly things, soft music playing. We do a really good job of grounding when we wake up from nightmares without even knowing it. So I always tell people if you have a nightmare, and you're not thinking about it, what is it that you do? And most people say, oh, well, I sit up and I get out of bed and I fluff the pillow and I go get a glass of water. Maybe I go to the bathroom, I take a few deep breaths. Yeah, you just did bilateral stimulation, which your brain likes because it likes it when both sides of your body move because it makes your brain work. That's what makes your brain go. You got something that you could physically hold. This is a tangible thing. Ooh, it feels cold. My brain registers. This feels cold. It feels smooth. I've got something going down into my stomach. It makes me reconnect with my body. And we do all that without thinking about it. Most of
Mhm.
us don't need to be told as children, get up, get out of the bed, go get a glass of water. We need that first bit of strength and braveness to get out of the bed because the monster is hiding under the bed. But once we can get our body moving again, our body takes care of us and gets us re-regulated. And so a lot of times when people are struggling with nightmares or sleep terrors or even just feeling like it's hard to fall asleep, I tell them build as many anchors into the room as you need, and you'll know when you don't need them anymore. Because that's the other question I get. How long? How long do I need to sleep with a stuffed animal? How long do I need to keep that sign up? There's going to be a moment, just like when you've lost someone and you have that moment of going, oh, it's been about a month since I thought about my grandma. You're going to know when you need to let go of the coping things. Just like being on crutches. At some point, your body's just going to take over and say, I can walk. I broke my ankle 5 months ago. It's okay. I can walk on it now. Your brain will do the same thing.
Yeah.
It's about that patience and about just trusting that your
Right.
brain knows and not pushing. We always want to push. We always want to be 10 steps
Mhm.
further than we are.
Mhm.
And boy, humans are impatient little boogers. We do not want to wait for the pace of change. We
Right.
want change now.
Right.
Yeah,
Thank
Yeah.
you.
Thank you.
of
Thank you.
course.
Yeah, thank
Yeah.
you, Manu, for asking that question, and thank you, Hester, for that response. I think I have to wrap us up here. So thank you all who stuck with us for the last 20 minutes as we had some really good conversation.
Mhm.
And
And
hope everyone,
if people want to, I was just going to say, if people want to contact me, I know I put my contact information on one of the final slides. You can email me, you can call. I'm always happy to take questions off on the side because I know sometimes there's just stuff that you didn't want to say in front of a room full of people, or that you have
sure.
someone that you're working with later that makes you go, oh, let me see if there's some way that I can get some support.
Right. We'll make sure you get those slides. Have a great day, everyone.
Thank you. Thank you.